It's a beautiful evening in Iowa City. We are in December. It's sunny. It's warm. Iowa City is getting ready to go to Rose Bowl.
Yes.
And we keep winning, and something is happening here that is very lucky. And we are lucky in our studios today and in our program Education Exchange to welcome Susie Poulton. Susie is one of the admirable leaders in our school district. I am Hani Al-Qadi, your host, and I will try to save time now quickly on behalf of John Karoff, Michael Peterson, Public Access TV, and Iowa City Community School District. I would like to welcome you to our show. And Susie, when I say admirable, I mean it. I know that usually the host, the producer, should be somehow very impartial and neutral, but I cannot hide my admiration for your job
Hani.
and what you're doing.
Thank you.
And the task you are, and the endeavors that you are dealing with on an everyday basis. And I know that our district has gone through a lot of changes recently and a lot of plans. It took a lot of time and effort. And now you are facing this demographic changes that's happening in our population. And I really don't want to go to statistics, and I will leave this for the board meeting.
Yes, sure.
And there are very nice tables there. But I care more about knowing your vision as a leader and working with a wonderful team of administrators there. So I would like you to address this nagging issue of the demographic changes and how this sometimes constitute a barrier to education, and how you as a team of administrators facing this and confronting this and try to overcome these barriers and give our kids the best education you can.
Thank you. Thank you, Hani, for having me,
Susie.
first of all. So, yes, our community is changing. There is just no doubt. Over the years, we are seeing more families. Well, first of all, we're growing, so we're seeing more families and more students in number. And then we're just seeing different needs and more needs. We have families, more families that are living in poverty. We have more homeless families. We have more health needs. We have children that are coming to us that do not have health care providers. We have children that are coming to us that do not have health care insurance. We have children and families with mental health issues. So we're just seeing more needs than ever before. And it's just the way of the world at this time. These are our kids, these are our families, and we need to wrap our arms around them and help them. So in order to be fully educated, you come to school prepared. And that still is the case for most of our kids. They have a bed to sleep in. They have a very supporting, loving family. They have, have 3 full meals a day. There is no issue about paying rent or paying a mortgage or buying groceries. But then we have other families that are struggling. And some of this, it affects children's ability to learn. It affects their ability to be in that classroom focused and ready to get started each day. So if they're hungry, if they're tired, if they're dealing with depression or anxiety or drug use, if they're worried about their mother or father who might be at home who's ill, if they're worried about their parents because they're fighting, if they're worried because their parents are unable to pay the rent and maybe they're doubled up with another family, this really affects our kids' ability to focus and learn. So as a district, we want them to be successful, so we want to break down what we call those barriers to learning. And we have put a lot of things in place over the years, and we're very, very fortunate in that we have these extra supports available, such as our student and family advocates, which are social workers primarily, who are available in every building to work with families and to help them overcome the barriers by accessing resources in our community. And in our county. Johnson County is rich with resources, but sometimes it's accessing them that is difficult. So our student family advocates work with families to make sure that they have a place to live, or they know how to get to the housing authority people, or they know how to work with their landlord, where to get services, how to shop for groceries, how to get groceries, how to go to the food bank, how to apply for food stamps if needed, that type of thing. So we have these things in place, these supports in place, and it's all about helping these families access resources and become more independent and more successful on their own, and then also help them connect with the school. So we help parents meet some of the basic needs for their children, and then their kids can come to school, be ready to learn, be like every other child, which is so, so important. So we're very proud of these services that we have in place. And it has shown that we have a better, improved attendance of these kiddos. They are improved academic success. So just overall, we have a very good graduation rate and a very low dropout rate in our district. And that has to do with quality teachers, quality education, but it also has to do with these extra supports that we have in place to help families kind of get on their feet and become independent, and their children become successful.
Great. Health kids clinics.
Yes.
Can you explain this to me a little more? Because I know that you open more of those and you have more nurses now?
Yes.
Okay.
Yes. So, well, first of all, we have school nurses. We could always use more school nurses. They still have a caseload of over 2,000 per nurse, so it's a lot. So we have school nurses that help, well, first of all, oversee a lot of things. Administration of medications to kids at school, helping kids with chronic conditions that need to have specific health procedures or medical procedures during the school day, accessing healthcare resources in the community, teaching staff about students' health concerns, first aid if students get hurt at school, a lot of prevention work, preventing communicable diseases, things like that. And the school nurses work closely with the building teams. And then in addition to that, we started Healthy Kids Community Care School-Based Health Clinic back in 2007. And it's a true community collaboration where we have a pediatrician from the University of Iowa, a nurse practitioner from the College of Nursing, and a volunteer physician, Dr. Peter Wallace. And we have clinics 2 days a week. And it's open to all children in Johnson County who do not have health insurance or have some other barriers to getting health care, such as maybe they're brand new to town and they don't know how to access a doctor. They have an insurance plan, but it has specific providers and they're not sure how to find those providers. Maybe there's no transportation. Maybe the parent is ill and cannot get their child to a physician. So we have this clinic that is on Tuesdays and Thursdays, Northwest Junior High on Tuesdays, Southeast Junior High on Thursdays, and it's a free medical clinic. And the reason it's in schools is because it's much more accessible. So for example, parents don't absolutely have to be at the appointment. We really like them to be there, but if they can't get off work, as long as we have their written consent and we're able to contact them, then our physician or our nurse practitioner will see the child, do the evaluation. This has been a great way to make sure that kids are immunized, that they have sports physicals so they can participate in sports activities, and also just to treat an acute illness. And then we work with the family to get them to a medical home, to set up something with a medical home if they qualify. We have some children that have had some chronic conditions that we have helped get connected with, like the Shriners Hospital, for example. And now we're working more closely with the university for specialty care as well for some of these children who don't have health insurance.
Well, thank you for mentioning Peter Wallace. He's a remarkable guy. You know, he never stops amazing me by the role he plays in the community, you know, from the head of the medical team at Mercy Hospital to a very active member of the Board of Education. And
that's
now you
right.
mentioned, this is new to me,
Yeah,
I
it
didn't
is.
know that, but
He's
yes.
been a champion for the school-based clinic. He was actually, well, he was at Mercy at the time that a community group convened to look at some of the barriers to learning, and unmet health needs was one of those barriers. And so he was very instrumental in getting the clinic started, and then continues to be a champion and fundraiser.
With tremendous
clinic.
experience. You mentioned immunization.
Yes.
And I would just, I know that the controversy that goes around this topic now in every place we go. And do you have a problem as a health director of the school district in trying to convince parents about immunization? Or how do you honor their desire if they don't want to immunize their kids?
Well, fortunately, there are some things in place through Iowa law that if a child is not immunized due to medical reasons or religious reasons, then there is an exemption for those. Fortunately, we've had very few, and overall our immunization rate is quite good. The school-based clinic has helped with that because we've been able to get children's immunizations caught up who are behind by going through the clinic. So for the most part, we have very good immunization rates. Of course, there are parents that are uncomfortable for whatever reason, and then we just really ask them to work with their healthcare provider on what needs to be done. We ask that there be a minimum set of immunizations. There's no doubt that children, the number of immunizations required is so much more than even when my children, who are now in their 20s, were infants. So there's so many more immunizations, so it's concerning. The other thing that we put in place is when there is an issue, like for example, now we're experiencing mumps. The University of Iowa has been hit with mumps, and we have had just a few cases coming into the schools. So the school nurses work with the office teams to review those records and make sure that all the parents of children that maybe don't have their 2 MMR, measles, mumps, rubella vaccine, that they are notified immediately and are made aware that there are mumps in the school, and then they can make a decision. Do they want to expose their child to that, or do they want?
Of course, when they are well informed about the future, that they may be get sterility or uveitis or orchitis, inflammation of the testis and the ovary and all that.
Yes. So it is a parent's and their child's physician's decision.
Exactly. The adverse childhood experience, the ACS, is that a program by itself, or that a training?
A little of both.
A little of both.
Yeah. So ACEs has come out of some 20-year research that has been done across the country. And it has looked at the experiences that children have and how it affects them into adulthood. And there's some really amazing research. So children that maybe have had issues with hunger, poverty, abuse, exposure, either exposure, being abused themselves or seeing violence in the home, those kinds of things, then have a much higher risk for developing chronic and terminal illnesses as an adult. So that's where it all started. And so that's been very enlightening to us. But also, we're learning through this research that children who are showing some behavior issues, and I think a lot of us, we maybe knew this, but there's usually an underlying reason for behavior issues. But the behavior could be related to some experiences that they've had, maybe currently or previously, that are adverse. Again, similar types of things. So it's really helped us open our eyes to how we approach children's overall health, physical and mental health, and to think about not what's wrong with them, but what are they experiencing? What's going on in their lives, or has gone on in their lives, that has led to the concerns, the mental health, the behavioral health concerns that they are experiencing at the moment. And then also being able to work with these kids and their parents to say, you know, if this continues, it's going to affect their long term. It's going to affect them into adulthood. So, and kids are very resilient. So, but we want to make sure that we're offering the right interventions, the right support. So this has been very eye-opening. And now there is actually, it's called ACEs Interface. So it is a training program that's available. And we have some trainers here in the community, through the University of Iowa, that will work with our teachers, our nurses, our student family advocates, our principals, just to learn more about ACEs and how we can take that information to our schools and to our classrooms.
When we talk about the mental hindrance to education, I know that you have developed new measures now to combat this. Can you address it a little bit more?
Well, I'm not sure what you mean by measure. We used to do a universal screening with all of our ninth graders, which we no longer are able to do, teen screen, because the funding for that has ended. That was
maybe
through
that's
Columbia
right.
University.
Maybe that's
that might be what you're thinking
yeah.
of. So unfortunately,
as an alternative to that, because what do you do? I know that you are cornered somehow.
Yeah.
But I would like to use this forum to raise the issue that we need to give mental issues more funding and more interest and more care.
Absolutely.
And not hide.
Right. So we're looking at different assessment tools. Okay, for example, we give every child the Iowa assessment every year, beginning in third grade.
Right.
And we really need to look at their mental health in the same way.
Right.
And do a mental assessment, and are they anxious? Are they depressed? Are they thinking of suicide?
Exactly.
Are they using drugs and alcohol?
Underline this suicide thing.
Absolutely.
Has been, yeah.
So we unfortunately haven't found another tool. The ACEs tool might be, that's a 10-question survey, so that might be usable for this, and we're looking at that a little bit further. We asked some questions on the Iowa Youth Survey, and that's 6th, 8th, and 11th graders. But the other thing that we have in place is through our student and family advocates and our building teams. So every building has what's called a student support team, and that is administrator, guidance counselors, school nurse, student family advocates, some teachers, depending on what child they're talking about, but making sure that we are looking at every child in that building and seeing, are they attending on a regular basis? Are they passing their grades? Are there any other issues, like are they in the health office on a frequent basis? Some of those things. Are there behavior issues? Have they been suspended, or are they on the verge of being suspended? And as a team, review and figure out, okay, how can we provide more support to this student? And so that is one thing that we're doing. It's not, we're not getting every child, but we're doing our best in that sense. And then we have a lot of mental health supports available. Like we have mental health counselors available to our buildings. And then through the school-based Healthy Kids Clinic, we have a child psychiatrist, Dr. Nancy Byer, and this is an agreement through the university that she has a child psychiatry clinic 1/2 day every week. So we have access to these resources that for children, again, who may not be able to get them elsewhere in the community. But we're still looking at,
Yep.
we need to do a better assessment. The other thing is we need to keep talking about it. And we need to not be afraid to ask kids these
And
questions.
since Columbine High, and they discovered that Eric and his friend were,
Yes.
I said, essentially in need for mental
Yes.
support.
Yes.
And had they received that, we would have completely avoided the disaster that happened after that.
Right.
So, I'm sorry, I think I want to use the 7 minutes that left in your show to address the nagging issue of safety in schools in light of what have been recently, whether it's a domestic violence, anger, or because of terrorism. Now, how you are getting ready to confront this situation that's full of uncertainty?
Yeah. Well, actually, Newtown, the incident in Newtown, Connecticut, really was eye-opening and a wake-up call to school districts across the country. And even just prior to that, we'd been having a lot more discussion on what we do to prepare our teachers and our children. And it's been a great collaboration with the local police departments. They keep saying it's going to happen. It can happen. It happened here at the University of Iowa, with the incident 91, gang loot.
Yeah.
So we have to stop saying
It won't
happen, because it's very likely that it could. So we have also then looked at what are we teaching our staff? So if there's an incident that someone comes in, like you say, it could be a
violent
disgruntled
intruder,
a violent intruder for whatever reason.
Armed terrorist,
Yep,
whatever.
whatever reason, we have to know how to respond in a way that saves as many lives as possible. And there is a procedure. It's called ALICE. The acronym stands for Alert, Lockdown, Inform, Counter, Evacuate. Not in that order, but these are your options.
I think
So-
you have given me a very detailed
Yes,
sheet
I
about
did.
Alice.
Yes.
So if any of our audience, any of our viewers would like that, I think they can contact your office, right?
Absolutely.
And they can get all the details of that. And then you give me another list of all the safety measures that were done, already completed in most of our schools, and some of them are in progress,
Yes.
and some of them are in the stage of planning yet.
Right.
But can you address the health part? I mean, as a former physician myself, I care about how the teacher would be able to save the life of somebody who just shot or something like that.
Right.
God forbid that this would happen,
Well, step back for a minute. So
Yes.
one thing that we are teaching our staff, and this is through Alice, is that we are all first responders.
Okay.
We are in the building and first responders, because in these incidents, the police are not going to get there in time
Right.
to prevent the violence in most cases. And they say that, they know that. So we have to work, first of all, to get out and get away from the danger. And if that's not possible, then we must try to protect ourselves or people around us. So locking down, barricading your door, that sort of thing. But there is the chance, of course, that someone's going to get hurt, shot, or whatever. Then we need to provide the first aid to that. And so part of the ALICE training includes the first aid, the first responder, what you do. So if someone is injured, if they're bleeding, how do you respond to that? So basically, the ALICE training also includes that first aid training.
That's wonderful. That's very reassuring because we need all our efforts together.
Yes.
Togetherness, and that's important not only to protect our kids but to provide them with a safe, quiet, calm atmosphere and ambience for learning.
Absolutely. You know, and schools are still very safe
Right.
places, but we must be prepared, and our staff must be prepared. And in such an incident, like I said, we want to make sure that getting out is the most important thing, but also communication, and communication with other people in the building, communication with our our emergency response team, our law enforcement, and then with parents as well.
Last week we had our physical plant director here who explained in details the structural measures
Good.
that they have done in schools.
Yes.
And I
a
think that
lot.
was very reassuring.
Yes.
Very reassuring. Our schools are in very good shape, and thanks to the great efforts of the administration and of the community in general.
Absolutely.
We have a couple of minutes. Would you like to address anything to our viewers?
Well, I feel we've made great strides in meeting the health, physical, mental health needs of our students and helping to break down these barriers to learning, and also just to ensure that our children are in a safe and healthy learning environment. So we've done great things, and we're going to continue to make improvements.
Mrs. Poulton, thank you very much.
Thank you for having me.
It is always a delight and an honor to have you here. And you always come up with new ideas and new vision.
Thank you.
And we feel great that you are directing this very important service in our district.
Well, thank you.
Thank you very much, and come back again and visit.
I would like to do that.
Thank
All
you.
right.
Thank
Thanks.
you.
Take care.
Our viewers, we are on Channel 18 cable, we are on Public Access TV website, Public Access TV stations, as well as Channel 21, the education channel, and YouTube. Don't forget YouTube if you don't have cable service. Thank you, and have a very good night, Iowa City.